Hello, everyone, and welcome to McGill Cares, a weekly webcast series addressing a wide variety of topics to support family and former caregivers. I'm Claire Webster, a former caregiver, certified Alzheimer care consultant, and founder of the McGill University Dementia Education Program. These webcasts are made possible thanks to the generosity of our donors and sponsors. Today's webcast is brought to you by Home Care Assistance. Home Care Assistance provides older adults with quality care that enables them to live happier, healthier lives at home. Their services are distinguished by the caliber of their caregivers, the responsiveness of their staff, and their expertise in cognitive care. Today's webcast is also dedicated to the memory of Mr. Marcel Gertin. So we're going to be discussing a very important topic, supporting daily activities in persons with dementia. My guest is Dr. Isabelle Gélinas, Associate Professor and Graduate Program Director at the School of Physical and Occupational Therapy, McGill University. She's also a researcher at the Center for Interdisciplinary Research and Rehabilitation in Montreal. Her research interests include the measurement of functional abilities in persons with cognitive deficits such as dementia. She developed the Disability Assessment for Dementia, a measure of functional abilities and activities of daily living, which is used clinically and in clinical trials internationally. Welcome to the show, Isabelle.
Thank you.
So today is a very important topic because as a result of the pandemic, many people, many family caregivers and informal caregivers have literally become, overnight have taken on a lot of responsibilities on their own. People that were dependent on services from local community organizations or people that had been, expecting to have a loved one or hoping to have a loved one at some point transferred into long-term care facilities that has been interrupted for now. So it's a very important topic that we're going to be addressing in terms of how to assist people to care for their loved ones. Before we begin, I'd really like to acknowledge the fact that you recently lost your own father to dementia. And I just wanted to ask you, because we've known each other for quite a few years now, how did your professional training in this field, help you along your journey? Did it make it any easier for you?
Thank you, Claire. Although we can never be completely prepared for this type of situation, and while we're living it, there's lots of hurdles. Definitely the fact that I have some knowledge about the disease, the various stages, some strategies that can be used as the disease progresses, and also about how to navigate the system because it's so complex. That definitely helped me. I think it helped me to be a better advocate for my dad, for my mom and my family. And that's often really a difficult situation that families are put into because they don't know what to do, where to begin, who to contact. And it's very difficult to advocate and have the right service at the right time for their loved ones and for themselves as well. So yes, definitely having the knowledge is something very important, and that's why these webcasts and the workshops that are offered are so important, because it's really a need that's been identified by caregivers, that getting information, being educated is something that they strive for, to be better prepared to handle the situation.
So today's topic, we're going to be, when we talk about daily activities really refers to the everyday important things that we take for granted. When we wake up, we eat, we get dressed, we shower, we go on about our day. But as dementia progresses, this becomes more and more difficult for individuals. So can you begin by explaining how does dementia affect the performance of these activities?
So there's maybe different patterns of changes in the activities of daily living, depending on the type of dementia, because they're very much related to the different changes that happen in the brain, the problems that persons are confronted with in terms of memory, being able to perceive what's happening in their surroundings. So depending on what's happening the patterns may be different, but generally what we do see is that as the disease progresses, the person is experiencing more and more difficulties with beginning with more complex activities, such as doing your budget, planning your grocery shopping list. So activities that are much more complex are the ones that tend to go early on in the disease process. At the beginning, they may be able to do the activities, but they start making errors, making a recipe and using wrong ingredients, using the sugar instead of the salt, for example. And as the disease progresses and becomes much more, the person becomes much more impaired, then the difficulties are more related to then doing things in the home, preparing a meal, and then going on an outing, driving is an example, or managing your own medication are complex activities. And as the disease progresses, then it's becoming more difficult to take care of your own hygiene. So bathing, dressing becomes more difficult, to the point where it's the more simple types of activities, such as walking, such as eating, that are then becoming a little bit are becoming more difficult, to the point where the person may be bedridden and is even having difficulties keeping your head up, staying sitting in the bed, for example. So there's a progression in terms of complexity, and there are also difficulties in terms of how the person does the activities. So they may have difficulty to initiate an activity, so not thinking that it's time to get dressed or that it's time to eat. Or it may be difficulty in how to organize yourself to do an activity. So if you need to bathe, like what do you need to be able to do that activity? You need to have your soap, the towels, so prepare yourself. And then the other aspect of activities that may be compromised, maybe the ability to actually finish the activity, complete it, and do it in a safe and timely manner. So there's different aspects of activities that can be change as the disease progresses.
And this becomes frustrating for the caregiver, because I think many family members don't realize that dementia impacts all of these aspects. And so what I hear from a lot of family members is, oh, the person's lazy, or they're being stubborn, or they used to always do it, how come they can't do it anymore? I don't understand. And I think what people don't realize is the fact that it's the disease that is causing them to no longer be able to do it. They're not doing it on purpose, right?
No, absolutely. And it's these problems with daily activities are really amongst the most important problems that are mentioned by family care and caregivers, because it impacts, as you're saying, it impacts so much on their own lives. It's oftentimes a change of roles for the caregiver, the family member. They may have to take on activities that they had never done before. And that leads to various emotional reaction, feeling of burden. And you're right, for the person with the dementia, they're also going through a lot of different emotional and behavioral reactions, because things are not as it used to be. And it's the disease, as you were saying. It's not because the person doesn't want to do the activities. It's something important to recognize, but the person may start to socially isolate because it's not anymore, they're not able to follow a conversation when we're there with families and friends. And safety also becomes an issue. Being able to leave the person alone at home, or even to do activities in the community, becomes a major concern eventually.
Okay. So as a result of COVID, some of the activities that are, or tasks that family caregivers were used to having assistance with, for example, bathing, feeding, getting dressed, and maybe having somebody come, and a companion coming and helping for a walk. But in many cases now this has stopped, and those are the activity, those are, let's say, the personal needs that require a lot of work. So what would be some tips that you could give to family caregivers to take over those tasks?
Yeah, I think you're absolutely right. There's a major shift in how people are able to cope with the situation, as you've mentioned. Um, I just want to mention that it's important that the person keeps being engaged as much as possible in daily activities, and in fact, being engaged, keeping mobile, like walking and doing exercise, is actually important also to prevent some difficult behaviors that we often see. So if the person is engaged, is active, that is helpful. Now, what is important is to try to do activities or stimulate the person to do activities that are not too complex, but are activities that are connected with the person's past interests. So things that they used to do in the past. We develop a lot of automatism when we do things we're used to do. So using these types of activities is usually better. As I was mentioning before, the complexity of the activity is something that's problematic as the disease progresses. So it's important to try to make these activities less complex. So it may be by breaking up the activities into tasks, or doing some tasks for the person, but letting the person do some of the parts of the task. So, for example, if it's cooking a meal, they may not be able anymore to do the whole meal, but they could do part of the meal with the family members. So they are still engaged, but it's parts of the task or simplified tasks.
Mhm.
Um, and it's important to try to let them do as much as they can, but the caregiver can provide some keys, like just to tell them what are the steps that they need to do. It's important with communication to keep to really short sentences and very concrete sentences. So communication is really key. And then you can use also cues from the environment. So putting pictures on cupboards to indicate this is where the silverware is, or this is where the plates are. Um, Establishing a routine is also very important, and really creating stability in the environment is crucial. It's important not to modify the environment continuously, because it does create insecurity and for the person. And it's important, I was saying, to stimulate the person, but it's important not to overstimulate also. And oftentimes we notice, if you're doing a party and there's a lot of stimulation in the environment, sometimes the person might get confused and insecure because it's too much. They can't handle it.
Mhm.
So it's the right amount of stimulation that is important to keep in the environment.
Mhm. I think also with regards to certain tasks, like for instance, getting dressed, what I like to tell the people, the families that I work with, is it's about also simplifying the choices. So, oftentimes family members say, my husband or my wife, they change their clothes 10 times a day, or they wear this, or they wear the same clothes. And I think it has a lot to do with, when they're in front of their closet, if there's too many things, it's hard to make that choice. It becomes just completely overwhelming, right? So to maybe pare down what's in the closet, have just a limited selection. Same thing with the drawers, what's inside the drawers. And also, I think what family members need to know is that as the disease progresses, the person really needs to be prompt to do things, right? Like they just need to be gentle reminders, prompt that it's time to, or maybe just lay the clothes out for them if they find it overwhelming, right? But if they're presented with too many choices, it becomes, like you say, just too confusing for them.
Absolutely. I think giving choices is important, but absolutely you can still provide choices, but by reducing the amount of choices, just
Yeah,
as you were
yeah,
indicating, having
yeah,
two pieces of clothing instead of a whole drawer.
yeah. So
Absolutely.
let's discuss the topic of bathing, because for whatever reason, we know that as the disease progresses, it becomes very, very disruptive for a person to be standing in a shower. We don't know why, but the feeling of the water on them is very disruptive for many people. And so what we find is that for family caregiver, for persons with dementia, they can go weeks, we hear from family members, without having a shower or bath. What is your advice with regards to bathing?
Yes, you're absolutely, it's true that it's often an activity that caregivers indicate. And even from a personal point of view with my dad, it was becoming more and more difficult with these activities. So what I would recommend as much as possible is to create almost like an environment that is comfortable, that is safe in the bathroom, because we know that the bathroom is one of the places where falls tend to occur more and more because of it's more slippery. And so you need to take into account the safety aspect, but also creating an environment that is comfortable, that is pleasant. A little bit like a mini spa, I would say. So you could even have music in the room, have good temperature, so make sure that it's warm, but also make sure that there's non-slip mat, handlebars for safety purposes, and to really, depending on what are the previous habits, I think for all activities of daily living, it's really important to consider what the person used to do before. It's not the time to change completely how to do things, but if the person preferred to take a bath or a shower, so there are different adaptations that can be provided to make this safe, and to also acknowledge also intimacy of the person, and in the way that if you need to provide some help and depending on the level of the progression of the disease, the person may be able to do it by themselves and just have cues on what to do, but there may be a point where they need physical assistance. And then depending on who does the activity, and how the other person, you need to take into account how they feel about receiving help from somebody else. And there are ways to make sure that some parts of the body are covered. So these are all factors that need to be considered, I would say, for that activity to be more pleasant. And maybe another thing is, if they just refuse to bathe, is to give a reason that you may need to go out and you need to get a shower before you go out. It's something that they used to do in the past. And take a moment also where the person is calm, in a good mood. There may be times where it's not going to happen because they're too insecure, confused, and then it's just a decision to wait at a later moment.
And I think I like what you said about, respecting the person's intimacy. Oftentimes I have families tell me that, they won't let the caregiver give them a shower. Well, I really think that the use of a bathrobe or covering them up, especially their private parts, with a towel, or, respecting their intimacy is very important, because I think what people are not necessarily always taking into consideration is that if this were I, and a stranger was coming to bathe me and I was completely without clothes in a shower or bath, how would I feel? The first thing I want to do is go and protect myself. So I think it's really about respecting their intimacy, and also, gauging their moods, right? Like, it doesn't always have to be first thing in the morning. If one day they're tired, maybe try later in the day. And also the approach, right? So if they're being forcefully put in a shower or forcefully put into a bath, they're not going to respond well. So I think I would also add, as a former caregiver, that, choose your moments, when you're also have the energy and the patience to do this task with them, right?
Absolutely. Yeah.
Yeah. So I'd like to now talk about some safety issues that families should be aware of, with regards to the home. But most importantly, because your expertise is in the field of driving, let's bring up that topic.
Yeah, that's a very sensitive topic. Because it's a very important activity for most of us. And when we survey older adults, for example, it's really their preferred mode of transportation. But it's one of the most complex activities of daily living. And it's so important for mobility, for social participation. But there's, on the other hand, a high safety concern for the driver, but also for other road users. So it's quite an important topic. difficult topics for healthcare professionals to engage in with the person, because of it can create issues, but it's a very important one. And oftentimes, family members are the first ones to see changes happening with driving, because they drive with the person, they see them in action. So it's really important as a family member to be to observe the person, especially if there's a diagnosis. Usually early on in the process, the person may still be able to drive safely, but as the disease progresses and in the moderate stages, really the person should no longer be driving. But it's really important for family members to pick up sign, like if the person tends to brake suddenly, drift in other lines, misses stop sign, stops at green lights. That's something that we may see. If they have difficulty making decision, when you have to take a left turn, but and not a flashing light or an arrow, or if the person gets lost. Sometimes also you can see the reaction of other drivers if they honk a lot at the person, or if you as a family member, you need to be a co-pilot, so the person needs direction from you. These are all warning signs that you need to little red flags, I would say, that you need to be aware of. And if you notice this sign, it's really important, first of all, to discuss it with the person, with your loved one. Choose your moment. It's important to do it in a moment that is calm, and sometimes it's useful to involve supportive family members if it's appropriate. But it's important for you to discuss your concerns. The person may be aware of it and may decide to make some changes or consult. Sometimes, because of the disease, the judgment and the awareness may be problematic, and then it may be important for you to talk to your doctor or a healthcare professional that you're in contact with. Even Alzheimer's Association, they may have people that you can consult, because they will assess the situation and they may refer the person for assessment to see whether the person is fit. But one more thing that I'd like to add in relations to that is that early on, even at the beginning of the disease process, even if the person is still fit to drive, it's really important to start preparing for the time when the person will need to do the transition from driver to non-driver. I mean, we all need to retire from work, and at some point in life, we will all need to retire from driving. So it's always easier if early on we start thinking of alternate modes of transportation or other ways to access services, so that when the time comes, it's a bit easier to do that transition and you're a bit better prepared.
And I think, for the family members' sake, they should be aware of safety issues regarding them, because I've heard many cases where when their loved one is no longer able to drive and becomes the passenger, that the person with dementia will grab the steering wheel, will play with the on-off button on the car. They could actually become aggressive with the family member who's now the driver, just out of frustration of no longer being able to do themselves. So I think if anyone is going through incidences like that, they may want to consider having their loved one sit in the back with a third party. But if they start experiencing aggression where their loved one's pulling the wheel, you need to be careful, because I've heard a lot of cases of that. So let's talk about inside the house with regards to daily activities. I mean, what would be some of the biggest risks in terms of mobility and falls? Like, what areas of the home would cause that?
Yeah, so that's one of the main risk factor in the home, mobility and risk of falls. And the areas that are most problematic are, of course, the stairways. But also, we've mentioned the bathroom is one of the most problematic, but also the bedroom, because oftentimes you may need to get up in the middle of the night to go to the bathroom, and getting up quickly may create dizziness, and there are high risk of falls. as well in the bedroom. So it's really important to make sure that the environment, to remove any loose carpets, any cluttering in the house, to make sure that there's no obstacle that the person can fall over. The type of footwear also is another thing that's quite important, to make sure that you have good shoes for mobility. Also, lighting is another one that's quite important. And during the night, you may have, those little lights that are put in the corridors. It might be a good idea also to have grab bars or bars so that the person can use. So really trying to make sure there's nothing in the environment where the person can trip over.
Even cords, right? From the cords from the lamps, or a lot of people have
Yes.
their cell phone chargers by the bed, and there's those cords that are lying around everywhere.
Absolutely, that's another good one, definitely. So anything that could be something that a person could trip over would be also very important.
Yeah, it's amazing how many homes I go into, and when I go check the bathrooms, that when people come out of the bathtub, the lack of having like a mat outside of the bathtub, or even something that's anti-slip inside the bathtub. And I mean, even I think what I think people also don't realize is, as the disease progresses, with regards to turning on the hot water, I mean, this is nothing really to do with falls, but it just made me think of how people, just if you have two switches turning on the hot water, how you can get burned. But
Yeah.
or maybe, I mean, how about the use of also anti-slip socks,
Yes,
anti-slip socks?
That could be something that would be useful, definitely.
Mm-hmm.
So the footwear, I think, is another very important aspect.
Mm-hmm.
And if the person needs some aids for walking, also sometimes it's important then to consult to get the proper adapted.
Now let's talk about medication, because there's still quite a few people who are taking their own medication. So what would be the risk factor in terms of medication?
Definitely one a risk that the person does not take their medication appropriately, or they don't take their medication at all, which may be a problem, or they take all of their medication at once. So it is one of the, I would say, in the complexity of some of the activities, it's a complex one. And so it's important, if there is a caregiver, then to make sure that the medications are not in an open cupboard where the person can, so to put them away in a place that is either locked, or the person cannot get to if they're not able to manage their medication. In the early stages, there are pills that can be prepared by the pharmacist if the person is still able to take their medication, but they are confused on which one to take when. Mm-hmm. These pills have the dates of the moment of the day, so that's a good way in the earlier stages, but there's a time when it needs to be handled by a caregiver. So it's important to be really aware and to look for signs, because as we may well think, the impact of not taking or taking inappropriately your medication can be very serious on the person.
I think that brings me to think about how we talked earlier on about simplifying, let's say, the closet for choice of clothes, but to simplify the cabinet in the bathroom, to make sure that there's no products or chemicals that person can ingest by accident. Like we teach at McGill, ingesting, cortisone or polysporin, thinking it's toothpaste, making sure that whatever is in the cabinet in the bathroom or the kitchen cabinet is safe, so that they don't think a bottle of Lysol is a bottle of olive oil, so being very mindful of all the chemicals that are around the house, anything that they could potentially ingest or think that could be candy, right?
Yes, I think that's very important. The kitchen is a place where we often have, because we have eating products, but we have also cleaning products. So anywhere around the house, you really need to go in with an eye of safe proofing, a little bit as we do with young children, so that you need to take away anything that may be not taken appropriately, that can be a hazard in terms of produce, but also in terms of equipment. And in the kitchen is a very good place in terms of where we have a lot of potentially dangerous equipment like the microwave.
So because I have to be mindful of time, I have one more question for you, for people who are listening. So what would be your most important piece of advice, not only as a professional, but as a former caregiver and to a family member who had dementia? Like, what did the experience teach you, and what would you say to others?
I think the first one would be educate yourself, but also the other one is to get help early. From healthcare professional, from services. Oftentimes, I think we tend to wait, but getting help early really can really be allowed to prevent even some problems for the person, but for the caretaker. The other thing I would say is to take advantage of respite care resources. And even early on in the process, because and personally that was the case, we often think, oh, it's not the time yet, but you can get easily burnt. So it's really important to take advantage of these services. There are very good ones available. And the last one that I would say is to take care of yourself, and to give yourself credits for what you do, and not guilt, because we oftentimes to put a lot of guilt on ourselves because we're not doing enough or we're not. But if you're not there, everything will fall apart. So it's very important to take the time as well for yourself. So these would be my 3 advices.
Yeah, especially as the disease evolves, it becomes so much more physical than cognitive. So family members really need to take good care of themselves, because it becomes a very physical job for them. And they, knowledge is power. And on our website at mcgill.ca/dementia, we have a link to many important resources to help family members, including the Alzheimer's Society of Canada, that has some very, very good information to help family members. Dr. Gélinas, thank you so much for sharing your knowledge and experience with us today, especially coming from somebody who's lived the journey. Please join us next week for our webcast on July 15th. We will be talking about navigating stress and loss when caring for a loved one with dementia with Dr. Tamara Sussman. She's Associate Professor at the McGill School of Social Work. Once again, this initiative of the McGill this webcast is an initiative of the McGill Dementia Education Program. We would like to thank today's sponsor, Home Care Assistance, for making this webcast possible. If you'd like to make a contribution, or if you'd like more information about our program, please visit www.mcgill.ca/dementia. And if you have specific topics or questions that you would like to address, please email us at dementia@mcgill.ca. Until next week, take good care of yourselves and of your loved ones. Thank you.